Hi, and welcome to this video on 10 of the most popular nursing jobs. First, the ICU nurse. ICU nursing is a challenging nurse specialty that requires a special set of skills. Sometimes known as a critical care nurse, ICU nurses use their advanced skills to care for the patient who is critically ill or at high risk for life-threatening conditions. Because ICU patients are in such critical condition, they often require constant attention, which means that usually you're caring for only 1 to 2 patients at a time. A travel nurse is a nurse from any specialty hired to work at a hospital for a certain amount of time. They typically work for about 13-week periods, and once they fulfill their contract, move to another area of the country where they are needed. Most travel nurses are represented by a travel nursing agency. A home health care nurse works with patients who might need continued care once they return home. These nurses usually work with elderly, post-op patients, or children who have ongoing health issues. A home health care nurse is great for people who would like to work outside the context of a hospital. The perioperative nurse prepares the patient for surgery. The circulating nurse cares for the patient in surgery, and the post-operative nurse cares for the patient in recovery. All of these roles fall under the title of OR nurse. Emergency room nurses treat patients when they are experiencing severe injury or illness. These nurses respond immediately to life-threatening scenarios and are trained to help solve them quickly. They can work in hospital emergency rooms, urgent care centers, sporting events, and more. The L&D nurse usually cares for 1 laboring patient at a time. Their role usually involves educating, coaching, caring for the laboring patient, and responding immediately when complications arise. An oncology nurse is responsible for the care of cancer patients. They typically monitor the well-being of the patient before, during, and after chemotherapy treatments, as well as other treatments. A flight nurse is a registered nurse who specializes in the comprehensive care of patients during medical evacuations and rescue operations aboard aircraft. They must be ready to respond to the most severe injuries under the most difficult circumstances. Most flight nurse programs require 3 to 5 years experience in a clinical setting such as the ER or ICU. A nurse practitioner is an RN who has continued their education and completed a minimum of an MSN degree. They are often able to open an independent practice, prescribe medications, and diagnose and treat a wide range of acute and chronic diseases. Many NPs choose to specialize in a certain area of healthcare. CRNAs are responsible for administering anesthetics in cooperation with anesthesiologists, surgeons, and other healthcare professionals. They hold an advanced practice degree and often receive high levels of autonomy and respect within the healthcare system. They work in various settings and provide care for every type of operation or procedure. If we missed your favorite nursing specialty, let us know in the comments below or tweet at us. Thanks for watching.